Hi, Prof. My name is Amrit, and now I will share my experience with the schizophrenia auditory hallucinations. Um, First of all, uh, when I played the video, wherein there were a lot of different voices saying some mm, negative things about you're stupid and stuff like that, and there were some voices which I was not able to understand also. So with that, my experience was not that good because when I played it in the beginning, it was okay. But when I started doing the tasks, which were the part of the simulation, it became very tiring for me because um, when I was trying to concentrate on the game, which was about digits, where I was uh, supposed to um, arrange the digits in an ascending order, but when I was doing it in the beginning, it was fine. But eventually, when I did it for the third and the fourth time, it became really tough. I was not able to remember where the digits were, and I think it was basically because of I was getting distracted because of the voices at the background, and also I had a very negative feeling about that video. Um, because to me it was very scary, and I was like honestly afraid of the voices which were in my ears all the time. And when I was doing my second task where I was supposed to shop, there the level of confusion increased because I did all the tasks back to back. So what happened was in the beginning I was able to concentrate on the digit game, but eventually when I proceeded with all the tasks and when I reached the game where I was supposed to shop the things on the sale, I was not able to remember the instructions clearly. So it was interfering with my memory also. I was really confused. I think that is why it was interfering with the memory, and my concentration level was, um, if I rate it out of 5, it was 1, because I was trying hard to focus on what the instructions were in the beginning. For example, uh, things in the circle which was green, I think that those were on sale, and there were other color codings like the one with the blue and the orange kind of color. So I was not able to recall all the information, and it was all because of uh, the the simulation effect which was there because of the uh, voices. And physically, when I was constantly hearing that sound in my ears, towards the end, I got headaches, and that was the thing which tired me, and I had to eventually stop the game. And with the confusion and with the frustration and low levels of attention and low levels of concentration power, uh, on top of that, when I was having the headaches, I was wondering how a person would feel who is actually suffering with auditory hallucinations. um, I was also thinking side by side, what if the voices tell them to do something reckless? A person who is hearing such a voice would not know what is the reality, and because that is his reality. And so person with schizophrenia and with auditory hallucinations um, should be taken care of, because uh, there are high chances that they might listen to such words or voices which constantly tell them to do something which can harm them, or which can harm someone else. So that was something which I started wondering after I completed those two steps of my simulation. Mm, so another thing which I want to mention is about the understanding of schizophrenia that I um, gained with the simulation. The simulation, I before this, I would like to tell you that I read this in my nursing course, wherein we studied about um, schizophrenia and other kind of um, psychotic disorders, mood disorders, personality disorders. I even saw patients with schizophrenia, but I was not able to feel what they exactly feel. Um, I could see a person and tell that he is visually hallucinating, or maybe he has a tactile kind of hallucination. And with the auditory thing, the patient has to tell us. So that was something which I never experienced in my past. So this simulation really helped me to have some perspective on this thing. And as I tried it, I think I can't completely understand what a person feels, but yes, I know that how it feels after the voices are constantly there in the background. So yes, it is tough for a person with schizophrenia who is hallucinating uh, to survive, because the constant voices in your ears, they are very distracting. uh, and on top of that, if there are words or things which are negative, harmful for the person or maybe others, it can be fatal for the person and can be harmful for the others around. For example, if a person lives uh, with his or her family and is having auditory hallucinations, and if the voices tell him to harm someone, so that is a risk for the family members as well. So which I think, in my understanding, makes it uh, even harder for a patient with auditory hallucination who has such kind of voices to be kept at home. But yes, I would like to learn and read about it more in my further in my classes. So yeah, uh, so in case I get a chance to support a person with schizophrenia who is hallucinating, or maybe uh, having some other major symptoms as well, so I would be very sympathetic towards them. uh, I would not just straight away go and tell them that this is not the reality. I would not tell them that the facts are these, and whatever you are listening or maybe whatever you're seeing is not true, because that would disorient a person. That would uh, make a person think that he he can't trust anyone. So um, I would rather take a approach wherein I would like to, if I see a person with who's hallucinating, I would try to clear out the environment. I would also like to decrease all the triggers which are around him. uh, I would take him to a safe place and decrease all the risks associated of getting harmed. And that's one thing that I will for sure do. um, I should not be giving them the reality checks. I should not tell them that there is nothing going on which they're seeing or maybe they're listening. And with the people who are on meds, the second thing which I learned from this simulation and the video that I watched in the beginning, the people who are on meds to control their symptoms, it usually happens that they have side effects. So, in those side effects, most of the people feel low levels of energy. They feel tired, they feel lazy, they feel lethargic, they feel sleepy, drowsy, kind of. And I would be careful if I'm their care provider, if they're taking their meds, in what ways they are affecting them. Uh, yeah, I would take that in consideration as well. And because I felt all the confusion in my mind, all the headaches, all the fear, all the scary things that I was feeling when I was doing the simulation, I would be very empathetic towards patients whom I would be dealing with. And so, yeah, that's all what I've learned today.